As with all things, including telebehavioral health, it's important to use the existing ethical decision-making frameworks, our existing ethical standards and codes to build our telebehavioral health practice. Some reminders: you want to know your professional codes of ethics and association stances. This is going to change given complex sociocultural frameworks, changing administrations, and legislative interpretation. So you're also going to want to know your state law, as well as some of the regulations around your insurance providers and anybody that you might be paneled with. Review your malpractice insurance policy to make sure it covers telebehavioral health, but then also they'll provide some risk management resources and potentially even some consultation. And with all things, continue to embrace the existing ethical decision-making model that you have as you interact with complex ethical dilemmas that take place in the telebehavioral health space. There are several nuances to delivering ethical telebehavioral health practices. I think confidentiality and privacy in a digital world is something we know a lot about. It's hard to know what's in the terms and conditions. It's hard to know what we sign away whenever we sign up for a new software or a discount at a retailer. You know, our information is currency, and it's bought and sold to some degree. So when we think about telebehavioral health, confidentiality and privacy concerns are present from the beginning, not just when we're picking a platform to use, but all the way through when we're meeting with an individual. So we want to ensure that confidentiality and security is paramount in all that we do, especially related to how information is transmitted and where it's stored. A lot of risks that we're familiar with include data breaches, unauthorized access, and hacking. You probably remember the early phases of Zoom's expansion in the pandemic, where Zoom bombing was a common occurrence, where people would pop into random Zoom rooms without anyone's knowledge of how they got there. Now, certainly the security is a lot better now, and any platform that you choose needs to have the highest level of security anyway, so that's less likely to happen. But I think there's a lot of risks related to who might be in your physical space and who might be in the client's physical space. You might not always know who's in the client's physical space because, again, you can only see this small portion of the video. So you don't know right now, is there someone sitting over here, someone sitting over there in my room? And because we don't know that, there are concerns about who can overhear our session. So it's not just about the technology and protecting that information. It's also about the client surrounding and being able to be clear and transparent in the informed consent process about what we expect in the physical spaces that we meet in. Emergency and crisis management. Hopefully you have a pretty robust plan in place for when you're meeting clients in your office in person, in your physical location, and you're going to be held to the same mandated reporting requirements in telebehavioral health. But this gets a little bit tricky because you not only need to know your resources available to you, but you need to know the resources available to those that you serve. So you need to have a general clinical response that we would for any client scenario or presence of potential risk, as well as a connection to local resources and how to connect them there. So a lot of this will include a crisis plan ahead of time so that you know what you're going to do, the client knows what you're going to do in each of those instances. So informed consent's paramount in all practice. I think it takes a little bit more of a nuanced and specific approach for telebehavioral health. So as with all informed consent, we're going to talk about the potential risks and benefits of telebehavioral health practice and how those are similar and different. We can talk about what will translate from, traditional in the office physical location work and what may not translate, as well as unique tools that we might have access to in a telebehavioral health space. We do need to give more disclosures about potential breaches to confidentiality and to broader data security limitations. We can only do so much to protect the data, and we're required to do what our regulatory bodies say are responsible use, and then also identify and communicate what those limits are to those that we serve. And continuing to elevate the mandated reporting and crisis intervention procedures. Some people may seek out a telebehavioral health practice because there's some safety or perceived safety in the distance that they might have. And without speculating too much about people's motives, which we're not going to prejudge anyone, I think we really need to not only have sound practices in place for the benefit of those we serve, but also for our own risk management practices, so that we can show that we've done what any reasonable counselor would have done in the same scenario. And we know that's the ethical bar we will be held accountable to. Did we do what any reasonable counselor, any reasonable social worker, any reasonable psychologist, any reasonable behavioral health practitioner would have done in that same scenario? You all are here now getting training in telebehavioral health, so much like any modality that you're going to use, you're responsible for being competent in receiving the training and documenting such to those that you serve. So going through this training is a great step. You'll be able to, have some base knowledge and skills, and you'll be able to, brand yourself as such. But the emphasis is going to be continued on you for continued education and growth. Some of the elements of in-person practice may translate, some may not. You may need some additional skills in mobile health, digital interventions, information security. You may need some additional skills. I do not believe that it's as simple as just saying I can do it in person, I can do it in a telebehavioral space. I think there's a little bit more that needs to happen. And some of those things you're going to learn about during this course. So when you think about your verification process, think about how you're going to communicate that in your professional disclosure statements, as well as on your websites, and what options for services you might provide to those that you serve. One of the biggest ethical, conundrums at times is just navigating complex ethical or statutory and regulatory frameworks that guide the provision and the reimbursement of telebehavioral health services. So you want to know the regulations in the state that your client is physically located in, where their residence is, but also even where they're at the time of the session, and where you physically are, where your residence is, where your home office is, where your physical office is, and then where you're physically located too. We often talk about this assumption that clients in the home, you're in your office, but perhaps you're in a different location. So it'd be important to know all of those statutory and regulatory policies and practices that would be that could impact the work that you do and your ability to do that work. Luckily, you may be able to pursue licensure in multiple states. There's an expansion of interstate compacts and reciprocity agreements in place. So you'll want to evaluate those where you're at and where your clients are at. And then also, consider your payer source too. They may have some unique limitations, restrictions, or even opportunities in the provision of telebehavioral health. Boundary violations are one of the most common ethical complaints brought to licensure boards, so it makes sense that this would be an important conversation around telebehavioral health, and I think the boundary issues are probably exacerbated in a telebehavioral health environment. There's sort of this idea of digital intimacy that happens when you see into the surroundings of those you serve, and they see into your physical space maybe in a different way than they would in the office. You're being invited into someone's home. Even though it's virtual, I think we don't want to overlook the potential meaning of that from a culturally responsive place. We might literally have a seat at their dinner table, albeit on a computer screen. So I think that there's some power, some meaning in that, but also the potential to blur boundaries. I think one of the pieces that often happens is the unintended disclosures that a client might make. What do you see in the background that maybe they didn't intend to tell you? And I believe firmly in the client's right to choose what they disclose and what they do not disclose. But maybe they disclose something based on, seeing an empty beer bottle in the background, or, seeing who knows what you might see in the background. But those sort of unintentional disclosures, much like any other disclosure, would need to be talked about and processed to some degree. And I think as counselors, we might also sort of fall victim to forgetting what's in our background at times. So making sure we're managing our physical space, helping clients manage their physical space, and treat that physical space entry as a really important entry point to discussion, to processing, and perhaps even to culturally responsive care. There may also be unintended participants, unintended recording, or undisclosed recording that people are making. So those become unique boundary violations that might happen. You might have it in your informed consent that they do not record the session, but they do. You might have it in the informed consent that no one else attends the session, but they do. That person that's attending the session might be the one recording it. So these are all things to lay out in informed consent. And when and if those boundaries are violated, to have a process ready to go for how you will engage someone when they impede upon that boundary, and vice versa. If you overstep by, welcoming yourself into their home a little more than maybe they intended, then that can be an important part that can either enhance or hinder the therapeutic relationship. And, depending on the modality, you need to set clear communication, availability, and response time expectations. I think much of what we talk about involves synchronous video telebehavioral health. But if we're talking about text, email, mobile health interventions, things like that, we really need to be clear about how to communicate, when to communicate, how available you can be, and when they can expect a response from you. You all have been in meetings and you've had that experience where they say, oh, you're muted, or can't hear you, or can you hear me? Now certainly you need to verify those things, and those occurrences in virtual telework also translate into telebehavioral health. So we need to be ready for assessing and building clients' competency to access and use the technology that's needed, and also providing backups and workarounds in case there are technical failures that could interrupt care. Perhaps maybe the most concrete example is someone mentions suicidal ideation and then the internet goes out. What are you going to do? Either on your end or their end, and you wonder what happened. So you want to have those backup plans in place. That will be a part of your crisis plan as well. And you're going to want to just have a base set of technology that's secure and stable, making sure you're hardwired versus using public Wi-Fi. Do not use public Wi-Fi. It's easier to tap into that, to hack into those sessions that way. So yeah, know your technology that you have ready, know your client's technology that they have ready. Ensure you both have the ability to adequately use that technology to not be a hindrance in the therapeutic process, and have a backup plan. And ultimately, if you can't get there, then perhaps it's just going to be a time where telebehavioral health isn't going to work for that person. As with all things, we want to go beyond cultural competence. Cultural competence assumes that there's an endpoint or a goalpost when there's really not. It's a process. To be culturally competent is really to engage in that ongoing reflective process about who I am, the intersecting identities that I carry, who the people I serve and interact with are, and their intersecting identities, and be able to know the complexities that those bring to the way that we experience the world and to be responsive of those differences. So we want to aim for cultural responsiveness in all care, but especially in telebehavioral health as we start to think about cultural, linguistic, and social differences that can impact the telebehavioral health relationship. There's some benefits to this, if we have closed captioning, might be really beneficial for someone that might have trouble hearing. If we do recordings and transcripts and things like that, that might be useful for some people. So thinking about it from an accessibility lens, I think is really important to help. I also think about, how do people want to communicate? Do they want to use emojis? Do they want to draw on a whiteboard together? Do they want to blur their background versus not blur their background? I think those are all really unique cultural decisions that I think you don't have to have all the answers for, but you have to have a plan for how to engage and process through some of those decisions with those that you serve. We all want to, keep the lights on, right? We all have to pay for our internet service, our computer, etc. So, I hope that in some way we want to know how to do the reimbursement and the billing process. So you're going to want to review the regulations related to your payer source, in addition to those other statutes and regulatory frameworks guiding your ability to practice, but also ability to receive payment and reimbursement, so that you ensure the correct billing codes are used, and you don't get in any trouble for using an improper billing code and then someone finding out it was done in a different modality. Documentation and record keeping remain super important. We need to protect all communication mechanisms and meeting platforms and need to maintain accurate and secure records. So depending on the telebehavioral health meeting platform that you use, whether that's embedded in your EHR or not, whether you're part of a group practice or a private practice or a big health system, all of those contextual environmental factors are going to influence the technology that you use, your record keeping practices. So you want to make sure that you're meeting all HIPAA and high-tech policies and any new regulations that might come. Because as we know, ultimately we're the ones responsible for the security of those records.